Hello, my name is Michelle Mottern. I'm representing really my son here for educational outcomes. This is my son walking with me. His name is Lucas. Hope this clicker works. The big one? Okay, wait. Oh, how do we go back? Red one? Oh, gosh. The red arrow backwards? There we go. Okay. So the title of my presentation is Recovering What Was Left. My son had a left functional hemispherectomy. You're going to see a lot of Star Wars pictures. I made that a theme. So there's also Star Wars quotes, little Yoda quotes, because they're the best. This is Lucas. He had Rasmussen's encephalitis. He ended up with the left functional hemispherectomy. This is him now in the scuba gear. That's what he looks like now. He's happy. Yoda says, "You must unlearn what you have learned." Kind of feel like that's been our journey because of a lot of the data that was lost with the surgery. Okay, so the roadmap, we were asked to talk about what kind of information we were given by medical teams. Of course, my topic is educational outcomes. That wasn't the forefront of my worries at the time. I was worried, would my son talk? Would he walk? What would he remember? So I remember a few things about the education topics. Speech was iffy because his speech hadn't transferred, and of course, speech and communication are a huge part of education. His neuropsychologist did tell me that the studies show that IQ drops after surgery, but tends to trend up within 3 years. We were shown some examples of children returning to school, but of course nothing about what happened after they got into the school. When we talked about when he would return to school, it was talked about hospital homebound, which is where the teacher comes to your home for a couple of hours each week, then to half days, and then to eventual full days. So we're almost at 2 years, and Lucas is just now going to be starting half days. So we've had a long journey here. The references of where to find more information, a mom blogger that was local, TED Talks on neuroplasticity, communication with another parent, but that never came about. However, since then, I was contacted and was kind of a patient advocate for the other parent, the other mom. So I know they do follow through with it. It just didn't happen for me. Oddly enough, the hemispherectomy conference was in our town at the same year my son was about to have his surgery, only 2 months before. And it was never mentioned to me, even though his neurosurgeon and his neurologist were guest speakers. And I thought that was strange. And then I found out that another parent whose son had a hemispherectomy the year before was also not informed about it. So I don't know what that was about, but I definitely would have appreciated that referral. So help, no guidance with regard to education afterwards in our situation. So patience you must have, my young Padawan. We had to get over a lot of things. Psychological triumph. Lucas was 14, and he had full function of his body at the time. And even though with the seizures, he was operating in a classroom with his peers. He was severely depressed after the surgery. He had aphasia. He had all the right side deficit, which was once his dominant side. He would sob in his room. And so we put him on fluoxetine, Prozac, that helped. But no one talks about that. I know with the little kids, maybe they don't remember and stuff, but our teenagers, they remember. Physical triumph, it took him a long time to have the endurance just to sit and try to have a lesson. He would put his head on the desk, he would fall asleep, and we finally got to a point where he could maintain for 3 hours. Mental triumph, some of his reading skills were retained, some of his math skills were retained. Okay. So our challenges today regard to his age. He's just turned 16 in May. His place, where does he fit, and where does he fit? He wanted to go back to school. He would say, "I want to go back to school with my friends." Well, his friends moved on, and he didn't move on with them. So the friends that are his peers now are really his younger sister's peers. And so his needs, he's regressed to probably about a second grade level with where he is and what he can do. And he knows it. He knows it. He'll say, I used to know how to do this. And he's not aware that he knew how to do it at one point. His time, he can go to school until he's 21, but will he want to? Because his friends aren't going to be there. So this is just some comparison data. In 2016, at the height of his seizures and his decline with Rasmussen's, he did go through some standardized testing, and I tried to compare the ones that he had. He was low average in verbal comprehension in 2016. Now he's extremely low. So, left hemisphere has always been a problem for him. So math composition, he was 92 average, and now he's at a very low 54, and you can see what kind of work he's doing there, tracing numbers, because he doesn't remember how to draw numbers. So reading comprehension, below average again, left hemisphere, and today, 2019, he is very low. So his surgery was his hemispherectomy was in 2017, by the way. So this is a video I put together, if it comes on. Oh, somebody playing it? Okay. A video is worth 1,000 words.
Please eat dog. Why? That one or that one?
He's trying to read a recipe.
This one.
Dog?
You said that one. And that T-O, what is that?
Dog.
Do you know that number? Can you find a number on the oven? If you had to put that number on the oven?
Yeah.
You can see the frustration.
What's that word?
Pan?
Pan. But what about the words that come before it?
Well, I do not know.
Are you able to see it?
Well, yeah, but I do not know.
It's okay. What's that word?
Empty.
Okay.
Bunny. Mixes. Egg. Water. Oil. And large bowl.
Good. All right. So I'm going to point to a letter, and I want you to tell me what it is. Okay?
A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z.
Okay, now let's go out of order.
Like,
what's that letter?
Work.
Work?
It's
What is it called?
a work.
A work?
Work.
Okay, so what is...
Like,
It
work.
is the first letter in the word work. You're right.
Yeah.
You're correct. What is that word? That letter?
A jet.
A jet. It's a first letter in jet. You're right. But it has a name.
I know.
It sounds like jet. J.
Well, I'm telling you, like, jet.
Uh-huh.
Good. J.
Is the first letter in jet. You're correct. You are right.
So now he's just trying to read a passage in Tom Sawyer.
You want me to read that?
Yeah, I just want you to read it.
Spending days, a few days, in the woods.
In the woods.
Now you do it.
Okay, well, I'll read this one.
All of it.
No, you're gonna help. Okay, here, you read this part.
After the ventures,
Is it helpful if I do this?
I do not know this, but after the,
You don't know that word? Adventure?
well, I do, but I do not know this.
With.
I do not know. It's like a grave or
This word?
yeah,
Gang.
gang,
Brave. Gang.
gang and pang,
Jim and
Stephen,
decided.
Jonathan, talking, easy, white, and few days in the woods.
Okay, so do you know what they were doing, these two people?
Chopping wood.
They were chopping wood?
I don't know, because maybe because I don't know.
Oh, because where were they?
In the woods.
They were in the woods, so you're saying maybe they were chopping wood because they were in the woods.
Yeah, and at nighttime, the wood is starting to get cold.
Nighttime, the woods get cold?
Yeah.
Yeah, that's true.
So let's see if I can go forward off that video. Oh, shoot, it's going again. Okay, wait. Okay, so what I'd like to know is, and sorry these aren't separated, they're a little jumbled, but what does the research say about literacy after hemispherectomy regarding, especially left side? Is there research regarding the best teaching methods for a child or adult after this type of procedure? And this is just out there because I've looked into a lot of programs. Is there any unbiased research on these programs that offer to fix our kids, that offer to fix their learning disabilities and with neuroplasticity? Because they're very expensive, and just wondering about that. But I'll just leave you with this quote. It's from a book I've read. If the boundary between what you can do and what you cannot do is not clearly defined, then you don't know what to try next. Recovery can be derailed by hopelessness. That's it. Thank you.